I'm just so honored that you asked me to do an interview.
We were so delighted to discover your work online. As a doula, you're different than a midwife.
A midwife is a medical professional, and a doula is hands off in the medical aspect. We're a support person.
Do you work for home births only, or do you do work in hospitals too?
I do it all.
Uh-huh.
I will never turn down a mom needing birth support because of
Awesome.
her choice of birth setting. And sometimes they don't have the option of having a home birth for complications, or they're just not comfortable. I do primarily specialize in home birth. I also am a doula who attends unassisted births. So many of the home births that I attend, there is not a midwife there. The mom is just, taking control of her birth in her setting. And then I'm there just as physical support, moral support, emotional support. So there's not always a medical professional at every birth that I attend, but I will attend hospital birth. Secondary trauma is a very real thing. And I have been subjected to a lot of secondary trauma over the last decade. I have really developed a different level of advocacy. And I've noticed a lot of patterns in the medicalized birthing industry. But I do have, and I know you didn't ask this specifically, but I do have certain lines where, as a doula, I need to be able to 100% fully support my client in every choice that they make, every choice. So if they're choosing a C-section, I will support that. If they're choosing pain relief, I'll support that. Any interventions, as long as they're making informed decisions, I will support that. However, if a client is going to continue to choose circumcision after they've been educated, I will very politely and professionally refer them to a doula who can support them, because I will not support that.
That's awesome. That's yeah, excellent. Yeah. That's the most professional thing. You don't want to participate in something that's just that you know better about. I mean, it's like
Yeah.
participating in a lynching. I mean, it's like, no, I'm not going to participate in a lynching. It's not,
Yeah,
it's,
that's exactly what it's like.
yeah,
And thankfully, out of all these years, I've only had one client continue to choose that. And they didn't choose it right after birth. It happened like 2 weeks later. And I subsequently learned about it at our postpartum visit.
I
So,
see.
but other than that, everyone's been able to be, successfully educated and had their eyes opened in the prenatal period. So that way, when they did give birth, they decided to leave their baby whole.
Awesome. Awesome. What good work you're doing. I just think, the boys that are born with your influence and your care and that have been protected because of your work, they'll never know, but you'll know that
Thank
you've
you.
done that. And
Thank
it's
you.
like that you can carry that for the rest in your heart for your whole life.
That's my goal. That's my
Yeah.
goal. I just want, like, they're born perfect too. There's no, like, we wouldn't be circumcising our daughters. Why are we going to circumcise our sons?
Yeah.
And I mean, it might not be a popular opinion, but I am vehemently against circumcision for every. I mean, we both know the medical justifications are so rare where it's truly justified and honestly warranted for a medical reason. Any other reason for circumcision that's not a non-negotiable medical justification, which is, again, so rare, I'm against it all of
Right.
it. Even, I mean, I respect everyone's freedom of religion, and I'm a Torah observant woman, and I have two intact sons.
Yeah. Good
Like,
for you.
there's no reason I would never. A lot of people are like, well, religion doesn't count. And again, I'm not everyone's cup of tea, and I'm very outspoken on even that aspect. And I just don't feel like it's ever justified.
Yeah, and when you talk about freedom of religion, what about the boy's freedom of religion? He's got a right to choose his religion. That's the whole idea.
Exactly. What if he grows up and he's like, oh, this is not the path that I want to take,
Yeah,
you know?
and if he
And then
for
when they're
some
adults, they can choose that for themselves.
exactly, yeah, it's the only way. It's the only way. I mean, otherwise it's just abuse. And who wants
Bodily
to?
autonomy.
Yeah.
We can't have bodily autonomy for one group of people and not for every group of people. It's hypocritical. It makes no sense.
Yep. Yep. It's like, yeah, if human rights means if you're human, you get full human rights. I mean, okay, you're human, you
Common
qualify.
sense.
How simple is
Common
that?
sense.
Yeah.
Yes.
So you've been pointed out about informed consent, and the level of informing, um, you have to fill in the informing that's not being done by the medical profession.
Yes.
How does that feel? I mean, they should be doing that.
It's frustrating. Honestly, Harry, it's frustrating. And it's frustrating to me because this is information that if someone was getting any other surgery, the doctor would be in, I mean, well, maybe not C-sections because they don't give informed consent with that either, but that's another topic. But if someone is getting a surgery, they're going to be given the risks, the benefits, and they're going to be informed of how their anatomy is going to change. That does not happen with circumcision. It's wild to me that the doctors that are performing this barbaric procedure are not informing parents of the absolute fact. And I have seen people argue this, but it's inarguable, the absolute fact of the loss of functions due to circumcision. They don't educate on the anatomy of the foreskin. They make it seem like it's no big deal, and they're not informing parents about the data that's out there that shows an increase in infections in intact males. That data is flawed, and that's
That's
not discussed.
that's another thing I really wanted you to bring up with you is that you've pointed out that the forced retraction is what's causing this skewed data that says that
Yeah.
intact boys have more infections.
Where's the proof that the data that they're presenting, which they're not even presenting it. If you, I mean, we all know Dr. Google. You go on Google, and that's what you're going to come up with, a whole bunch of Mayo Clinic nonsense, Johns Hopkins nonsense. And where is the 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 evidence that the control group is having proper intact care? Because
Right.
doctors are educating parents to retract.
To
So if
injure. They're telling
doctors
the
are saying,
parents
yes,
to injure their child. It's just, this is so corrupt. And we just have to keep pointing it out. The whole circumcision industry is just corrupt through and through.
yes,
And it just, there's no, you can't stop pointing it out. It just has to keep, we have to keep repeating that because it's hard for
yeah,
people to, there's this thing called cognitive dissonance, as you know, that's you tend not to accept an idea that's inconsistent with other ideas you already hold. We think of the medical profession as helping and healing people, and yet
yeah,
the evidence on circumcision is that they are intentionally harming people and lying about
exactly.
it and failing to inform, and it's just, it's very, you have to keep repeating this because it's hard for people to wrap their head around something so wicked and
It
corrupt.
really is. And the amount of, I mean, this is a topic that I share about pretty much more than anything on all of my social media accounts. And I get so many comments that, moms that chose to keep their sons intact, and then they'll be commenting on a video that I make about hygiene. The doctor told me to pull the skin down, and my son's had continual infections for years, and I had to get him circumcised. I mean, the medical profession is causing the problems that we're seeing. And if people were properly educated, the thing is, the information is not, unless you go digging for it, and we all know the stuff that really matters gets buried. So unless you're digging for it, or you're looking on activism websites like your website or like Your Whole Baby or Saving Sons, you're not going to find the information that you need to be able to properly care for your child.
That's
So
so
then you
sad.
hear, it's so sad. And then a mom will talk to another mom who says, "Oh, I got my son circumcised and he was fine." They're always fine. My husband's circumcised, he's fine. You have nothing to compare it to. You can't make that decision.
Yeah.
Like, I mean, it seems extreme, but I'll always say, well, are we just going to cut our hands off at birth so we don't have to wash them? Makes no sense.
Yeah, exactly.
No sense.
You have to, but even then, you have to keep pointing it out,
Yep.
repeating it over and over again. Finally, the light comes on. I mean, some people it comes on right away, but for most people, I've been indoctrinated to believe that circumcision is a good
Yes.
thing, and you just have to work at it. I'm sure you know. I mean, some of your
Yeah.
clients probably don't get it on the first take.
They don't. They don't. And 99% of the time, it's, I don't have that part. I'm going to let dad decide.
Mm-hmm.
And it takes, I mean, just imagine being an American male who's been circumcised at birth, who almost everyone they know is circumcised. They've never had problems, or any problems that they do have, they've never attributed to their circumcision. They've had no idea. So the few boys growing up that have been left intact, what happens to them? They get made fun of in the locker room because they're the minority. And then the dad says, well, I don't want my son to go through that. I had it. I'm fine. So we're going to do the same thing. Wash, rinse, repeat. Like, I'm just going to continue to purge that information out there. And I've had quite a number of moms say, I'm pregnant, and because of your videos, I'm choosing to leave my son intact. Then my job for that day is done. And then
Yeah,
the next day, same thing, wash, rinse, repeat. Keep putting the information out there.
yeah,
It takes a very um humble and I don't even know the proper word. I almost want to say confident male to admit that he was harmed.
yeah. It
And
does take
look,
confidence. It
yeah,
does. Yeah. I mean, if you're weak, you can't admit any flaw or any deficit. And if
and
you're
you won't
strong,
look into the information. You
yeah,
won't look into the information that's showing what your parents subjected you to.
yeah,
I mean, and honestly, like, I'll also just say this, it also goes for intact men too. A lot of intact men, like, they don't know what their life would be like without a foreskin. So for them to learn, I watched it with my husband. He watched American Circumcision. He's like, I never knew any of this. The under education from males about their own body in both aspects is severely lacking. So it's not surprising to see parents just suffering from cognitive dissonance when they're faced with the fact that circumcision is actually genital mutilation.
yeah,
They're like, wait, what?
yeah,
Like, it's, they're so against it for girls without even knowing anything about it. But when you present it as in regards to males, the light bulb, it does come on. It just takes some time.
yeah. And repetition. It just like hammering a nail. You just you have to keep hammering it in because it
Yeah.
just isn't going to happen. For most people, it's not going to happen the first time. And for
No.
and for cut men, it's not just ignorance, it's active suppression of something that they don't want to face. So you're
Yes.
really overcoming an active denial, active suppression, because the reality is devastating when they think the people that were supposed to protect me harm me. I'm lacking something that would have made my whole life better.
Yes.
I'm damaged. I'm hurt. I mean, it just the emotional baggage there is just it's really a lot, and it takes a certain amount of compassion and I guess patience and just
Yep.
understanding because it's if a guy is saying I want to cut my son because I'm cut and I want him to be just like me, blah blah blah, yeah, I want him to be like me, and it's like,
Right.
well, okay, but think about it. If you were missing a hand, would you want to take off his hand? I mean,
Right.
is that really what you want, guy? And
Exactly. And they're not gonna, it's so hard for a man to just like you said, to face the fact that this was all taken from me. This,
yeah,
I've been living my whole life with a partial genitalia, believing that all it is a flap of skin. It's just a piece of skin.
Yeah.
That's the media narrative. It's just a piece of skin.
We're dealing with entrenched corruption. We're right. We have that on our side. That reality is on our side. So we just keep pointing out reality.
We
Oh,
weren't born with extra parts. No one on
exactly.
this earth was born with an extra, like we don't
Yeah.
have extra genitalia.
Yeah.
Like if you're a typical man, you were born with everything that you're intended to have. And when you grow up and you can make an informed decision about that, your body, your choice.
Yeah.
Like his body, his choice. Why does that not apply to baby boys?
Yeah.
And it just, sometimes people don't have never even thought of that, and they hear that and they're like, wow, why aren't we giving them that choice when they're older? It's not my body, but they say, well, I'm their parent, I make the decisions for them. This isn't like, not letting your kid eat a whole cheesecake in a sitting. This is a permanently life altering surgery, and you're making that decision for them.
One thing you could also point out is that almost all circumcisions are done before the age of 1, and intact men
Yep.
almost never decide that this is what they want. So if you
Yeah,
know that they wouldn't choose it for themselves, how is it okay to force it on them? I mean, is what kind of love is that?
exactly. And not only that, but when parents are making this choice, the doctors are not telling them exactly how it's going to be done. They say, oh, it's just a little clamp and they don't feel anything, and they get sugar water,
It's
they get sweet ease and a pacifier. Oh,
yeah,
we give them a dorsal nerve block. The
it's
doctors
corrupt.
are not talking about any of the reviews that have been done on these medications that are supposed to prevent pain. They don't eliminate the pain entirely. There's so much data out there that shows that babies, no matter what you give them, because we're not giving babies general anesthesia and intubating them and putting them under. We're giving them some cream, a little shot, and parents think that their baby's not going to feel that. And then the doctors say, oh, they slept through it. They're not talking about immediate shock. They let out one cry. It's so intense that their brain shuts down and they just stop.
Yeah.
Like, Brother K shares so many wonderful things on his TikTok about this, and about doctors and nurses talking about what they witness. But we're gonna ignore all of that because we think that it's cleaner, and we're not even gonna look into it. It
Yeah.
just it's so sad to me, and that's why I really made this topic like my main focal point on all of my social medias, because it is the worst thing that anyone could do to their child. Like, I truly believe it is. I mean, it's apart from a couple of other rare circumstances and, disgusting situations that people put babies in, this is like the worst routine thing that anyone could ever do to their baby. And it is literally my mission to try to stop it, and
Awesome.
to just jump into the middle of the voices, and just be loud and obnoxious about it,
There's
and
a
never
time.
stop.
Yeah, there's a time to be loud and obnoxious. That
Yep.
that's exactly the time. Yeah.
I'm grateful that I even have the platform to talk about this. And I have also shared, like, when we made our decision to keep our son intact, our first boy, I am always very upfront. It wasn't an immediately educated decision. The reason that we chose to leave him whole is the same reason that many parents choose to circumcise, because dad is. So my husband was born in Haiti, and this is not something that they do in Haiti. Just like almost anywhere else in the world, they're not circumcising baby boys.
Yeah.
And you know, he was like, well, I never had any problems. I don't see why we would do it. And I'm like, yeah, let's just not do it. And, we'll maybe do it later down the line. And the way my brain works, I'm like, let me just look into this and see what I could find. And everything that I came across in the beginning of my research was in support of genital mutilation. It was supporting it. I had to dig so hard to find the evidence that really disproves everything that comes up on the first 3 pages of Google. And when I came across, someone said to me, watch an infant circumcision procedure video on YouTube. And I was like, they have that on YouTube? I'm like, all right, well, let's just check it out and see what it's about. And because I wanted to make the best decision possible. And I couldn't get through the first 2 minutes. And when someone says, what would you recommend for someone wanting to circumcise their baby? Watch a procedure. If you can get through that procedure without wincing, closing your eyes, covering your ears, and you can watch the whole thing from beginning to end, you might need to seek out some help. Because
Yes.
I don't know. I don't
Yeah.
know one person. I've had people claim I watched it, it was fine.
Unbelievable.
I can't believe that. There's no
Yeah.
way.
How
There's
could,
no human being on this planet that could watch that. Any sane, rational human being that would be able to watch that and get through it. That is always what I suggest. First and foremost, go watch that. If you're not convinced at that point, well, then let's talk. We have other resources. But those procedure videos that they have posted on there are, in my opinion, the best tool to educate a parent, because they're not doing this on sedated babies. You know, like you see the doctors shove the little pacifier, give a little shot, and those babies just, they go right out. They pass out. And it's so obvious. It's
yeah.
so obvious. It's heartbreaking to me. And that's why I do what I do, because, you know, when a son is born, a mom and a dad, the love that they feel, how are you going to go in there and change? Like, you're going to tell me your baby wasn't born absolutely perfect? You know that they were born perfect. So put your ego aside and say, you know what? I was going to make the wrong decision, and just leave them whole. It's so much easier to even care for an intact baby. You don't have to worry about creams and ointments and a baby bleeding out and a scab forming and cleaning feces off of a raw open wound.
Yeah. It's
I,
just how they sold this to American people is just, someday there'll
you
be a book about
know,
it. It's just shocking that, yeah.
if you go back in the day, go into history, it started as a way to stop masturbation.
Yeah.
Uh, 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 that was real effective in today's society. There's
Yeah.
literally no reason. There's no reason to do it.
Yeah. Everything about it is just heartbreaking and sickening. But
And you have to be loud about it. You have to draw attention to the topic. Like bloodstained men, how many, that any protest that you guys do is going to get the attention of every single person in that area. No one's going to miss that. No
yeah,
one is going to miss that.
they see the blood stain, and it makes an impression. And
It does.
even if they pretend not to care, it's made an impact.
Exactly.
Yeah.
They're going to go home and they're going to think about that.
Yeah.
It's going to be on their mind and they're going to look into it.
Yeah.
They're going to go to the website. They're going to see the resources. They're going to see the testimonies. And then the men that have been cut at birth, the ones that speak out about it, I feel like they do so much for the movement. And it takes a very strong man to be able to talk about the fact that they were harmed at birth. Their body has been, you know, a lot of people don't like the term, but it's almost like you're purposely handicapping someone. Why are we doing this?
Yeah.
Like, you're taking a fully functioning body part, you're removing function, so now it's dysfunctional. And people don't want to talk about that.
Yeah.
But that's what it needs to be brought to light.
Yeah.
It needs to be discussed.
Yeah. Well, you're doing such an awesome job, and you're right there at the point of decision where you can really influence young moms, and they really listen to other moms. You know, sometimes the bloodstained men can uh, make an impact, but moms really have a big impact. And so what you're doing is just
Yeah.
awesome, Victoria.
I'm so grateful and honored that you asked me to do this interview. I really am. I've been following your activism for since my son was born. He's actually today's his 9th birthday.
Hey,
And he I haven't had all that full discussion with him yet about what could have happened, but I feel like that's something my husband and I are definitely going to talk to him about one day when he can process that information. And your page is one of the first that I had come across
awesome.
that
Awesome.
was showing the harms of circumcision. And I saw a video from a mom who I can't I'm trying to remember how long ago it was posted, but her son's genitalia got shredded from a botched circumcision, and that stuck with me. And when my son was 3 years old, we had like a little daycare that we were running out of our home in New Jersey, and we watched this little boy. And his first day, his mom dropped him off, and she said to me, "He had a botched circumcision. I just want to let you know. So when you change his diaper," and I was like, "Okay." And at that point, I was already like, anti-circumcision to the core, but very respectfully and politely, I was like, "Okay." I didn't, give her any. I'm sure she gave herself enough grief. And when I changed his diaper, I froze up. I started crying, and my heart just broke because I'd never physically seen, like, obviously I've seen circumcised babies before. I've taken care of babies, but I never seen a botched circumcision. And the reality of how common that is, the plastibell not coming off properly. It literally looked like he had fringes. And it was the saddest, most heartbreaking thing I ever saw. And his mom said, "I'm going to have to get it redone eventually." And just the fact that he's going to have to go through that again, that stuck with me. And that was really when I started speaking out about it. And I mean, I would have never thought that all these years later, the platform would have turned into what it has. And I mean, I'm grateful to TikTok because there's so many young people on TikTok,
Yeah.
so many young people that are not on Facebook. They're not even on Instagram. They're on TikTok. And that is really where I try to put out the majority of my content, and to be able to connect with Brother K and then subsequently it lead into this interview. I'm just so grateful. I really, really am.
It's just been such an honor to have you with us. I mean, I've learned a lot, and you're doing just the most awesome work, and you're doing great stuff, and I'm just so glad to have a chance to talk with you.
Thank you very much.
Okay, Victoria, we'll leave it there for now, and hopefully maybe we'll be able to chat again at a later date.
I'm always available for the Bloodstained menu. Just let me know.